For lumbar safety checks, we've got 3 checks that we do, and I say lumbar, it's actually lumbar stroke thoracic safety check. So what we're looking for is whether or not there's a bulging disc. They'll have come in with something like sciatic type pains, i.e. pain down the leg, maybe into the foot, might just be in the glutes, but there's something to suggest that you think that there is some sciatic nerve involvement, or even actually femoral nerve involvement, because you could get that with a bulging disc, but we're looking for a bulging disc. And we've got 3 tests. We've got the straight leg test, drop leg and the bounce. So first of all, let's have a look at the straight leg test, because that's the first one that you do, and this is very much for lumbar, not thoracics. So we're wanting to lengthen the nerve. So the first thing that we do is we lengthen it by putting our forearm on the foot and dorsiflexing the foot, because the nerve comes down the back of the leg and that is now making that nerve longer. We want to keep the leg straight, so if we put our hand just above the knee just to stop it bending, and all we do is very slowly, asking them all the time if everything's okay, gradually lift the thing, and it needs to be really, really slow, because at any point it could kick in. Is that okay? Yeah. Now you'll get to a point where you can't go any further because the hamstrings are too tight to go any further. That's fine, that's just muscle tightness. And don't try and push beyond that. So if they start saying that's getting a bit tight down the leg, the question is that just tight down the leg because it's a tight hamstring, or is that the pain they came in with? So that's the question to ask. Is that feeling the problem pain, or does that just feel like a tight muscle? If it was a tight muscle, then come back down, and the next one you do only if it's a tight enough muscle, not if you've already got reproduced that pain that they had, is you do the drop leg test, and you can just do it on the way down. So when you get fairly close to the couch, so we're talking about no more than that off the couch, don't drop it from some great height, just let the leg drop and see if that elicits anything. If neither of them elicits anything, the chances are there's no problem with the disc. So you've got your straight leg test, and just keep asking them and see if the pain they came in with is replicated. If it's just a tight muscle, come back down and try the drop leg, but only do the drop leg if the straight leg test was okay. The next one, the bounce test, is you want to move them onto their front, so if you mind turning over now. Now, you'll be doing it on the same side, but for the purposes of this, I'll do it on the opposite side so you can see what I'm doing. This is more a thoracic safety check than a lumbar safety check. Remember, you've got kidneys in here, so you don't want to be putting too much pressure on this part of the back. We will start at the lumbar, but just very gently. So the angle of your hand, and you can do this closed or unclosed, is here's the spine. It's easier when they haven't got clothes on because you can see exactly where the spine is, but there's the line of the spine. And here's the erector spinae muscles here, and it's those erector spinae muscles that you're using to push with. So we've got this area of muscle here that you're using to push. You put your hand at a slight angle, so it's not straight across, it's slightly with your fingers pointing upwards, and you're just going with your heel of your hand into that erector spinae muscle. Now remember, as I say, on those first ones, do it very gently because you've got kidneys and stuff in the way there. And it's just a push in. And it's these thoracic vertebrae that we're really testing to see if there's a bulging disc in here. It's unusual, but you could have it. So again, you're constantly wanting any kind of feedback from your patient as you go up one vertebrae at a time, and you go obviously every vertebrae all the way up that spine, just giving a little push each time, right up to T1. When you get right at the top, just be careful, you have to kind of angle your hand a little bit so that you're not pushing onto the neck. So that is the bounce test. So that is primarily for the thoracics, and it's looking to see whether or not there's a bulging disc in that thoracic spine. So that is your 3 lumbar stroke thoracic safety checks.